Joshi, everyone, and a very warm welcome to this evening's BAPS Wellness webinar titled Your Breast Health Matters, Early Detection, Early Treatment. We're delighted to have you join us this evening. My name is Arti. I'm a GP and also a volunteer with the BAPS Wellness team. Tonight's session is part of the BAPS Wellness Initiative, which is all about promoting lifelong health through nutrition, exercise, sleep, and stress management. This holistic approach is inspired by our gurus, Pramukh Swami Maharaj and Mahant Swami Maharaj, whose teachings remind us to care for both our body and our spirit. So we're here today because breast health affects us all. It touches families, communities, and lives across every age and background. South Asian women in the UK often have a lower screening participation and sometimes present with more advanced disease when it comes to breast cancer. Yet, breast cancer remains one of the most commonly diagnosed cancers worldwide. But here's the good news: early detection truly saves lives. We're fortunate to be joined by a panel of speakers today who bring with them a wealth of expert knowledge and lived experience. There will be an opportunity to ask questions after the talk, so feel free to type them into the chat as we go along. We will do our best to answer them at the end. And just so everybody is aware, this session is being recorded. Now let's get started. First, I'd like to introduce Miss Meera Joshi, a doctor. She is a consultant breast surgeon working in the NHS who will be speaking to us on the topic of breast cancer. So Miss Meera Joshi, I'll hand over to you now.
So thank you very much, Jay, this evening, and thank you for joining this important topic on breast awareness. So we're here today to learn about breast cancer and to take care of our health, to separate and also to support each other in our journeys. So breast cancer is where cells in the breast grow abnormally. It can form a lump in the breast or changes in the breast shape or size. And it's important to say that not all lumps are cancer, but also there are conditions that we can pick up early, such as ductal carcinoma in situ or pre-cancer cells. And these are often picked up through breast screening. Breast cancer is unfortunately very common. It's the most common cancer in women, and 1 in 7 women will get breast cancer. The good news is that when it's caught early, the survival is greater than 90%. So really important to catch any symptoms or concerning signs early, and to attend screening, which will be a theme of the talk today. There are risk factors with breast cancer that I'd like to talk through. Some of them are uncontrollable risk factors, and some are to do with prevention. So things that we can't control are gender, so being a female has a higher chance of breast cancer. Other factors like genetic history or early time that periods start or late menopause. But there are lots of things that we can control. And this is really about emphasizing exercising, maintaining a healthy weight, reducing processed or fatty foods, improving our sleep cycle, all of these factors, as well as reducing hormone replacement therapy in different ways. And all of these things can reduce our risk. Early detection really matters here. And I see it time and time again with patients because it leads to easier treatments, less invasive treatments, and a better survival and quality of life, which is key. What I encourage all women to do, and everyone that I meet in clinic, is to make sure that they examine themselves at least once a month, have a good look in the mirror, feel all parts of the breast, the armpit and the collarbone region, and report any changes to the GP in the first instance. And we'll talk through a little bit about the examination. General inspection, so really important to see what's normal for you. Look for any lumps, any skin changes, changes to the texture or colour of the skin, and really paying particular attention to the nipple as well, looking for any signs of discharge as well. Palpation, so palpation is really important, and I always encourage women to use the palps of their hands as opposed to the tips of their fingers. And to examine a little bit like a clock face of the breast, with the upper outer area, the lower outer, lower inner and the upper inner, as well as the armpit areas for any lumps or bumps, and in the top of the clavicle and below the clavicle as well. Unfortunately, at the end of this seminar, there'll be a short video on how to do all of this. Common breast symptoms. So it's important to say that not all breast lumps are breast cancer. It may be a cyst or it could be fatty tissue, but it's really important for anything that's new for women. So any lumps or thickening, skin dimpling, or changes in nipple size, and also persistent pain. There are lots of common conditions in the breast, lump being one, but also things like pain and nipple discharge, and not all of them mean cancer. So a breast lump, it's important to refer anything new, but really important to make sure that when examining to really have a good examination of the nipple areola area as well, because unfortunately that area in particular can be easily missed. Breast pain is a really common symptom. And I'd like to say that 90% of breast pain is not a cancer. 70% of breast pain is associated with monthly cycles, and there are many causes such as hormonal changes, hormonal treatments, but also medications. The treatment is often that of reassurance, to wear a supportive bra and pain relief gels, but anything that's concerning, to get it checked by your GP. Nipple discharge, this is also really important. This could be a serious condition, and I encourage people to keep a diary of the discharge, which breast is affected, whether they can see it's coming from one area or several areas, and what colour the discharge might be, and any concerns to please see their GPs. With any of these symptoms, typically the GP refers patients to a hospital clinic. They undergo something called triple assessment, and that means that they get an examination or a history and some radiological tests, such as a mammogram, which is an X-ray of the breast, or an ultrasound scan. And some patients have a biopsy. Now, it's really important to say that not all patients having a biopsy are really concerned about cancer, but sometimes they just wish to check the area as well. Generally speaking, anyone above the age of 40 gets a mammogram or an X-ray of their breast, and women under the age of 40 typically get an ultrasound scan, and that's to do with how dense the breast tissue is and which tests are more sensitive at certain ages. Screening is really important, and the NHS invites women from the age of 50 to 70 to attend screening, and you should go every 3 years. Mammograms can find cancers that are very early or too small to feel, and if they're treated early, they can have very good success rates and overall survival. So it's really important to attend, even if women aren't symptomatic. And also, it's important to say that between screening intervals, so if you've had a breast mammogram at the age of 50 and then have some symptoms at the age of 52, important to get it checked. So I'd like to talk a little bit about ductal carcinoma in situ, which is a precancerous condition, and it's not really picked up on symptoms, but more picked up on screening. And this is where there's some abnormal cells within the milk ducts. And we know that if these are not treated, they become a cancer. And there are different grades, such as low, intermediate, and high grade. And it's important to say that most of the time, these patients are treated with surgery. So a little bit about breast cancer now. So breast cancer is often picked up, as I've mentioned, in the triple assessment clinic in the hospital with radiological tests and also biopsies. And staging of breast cancer, we look at tumour size, so how big it is, but also whether or not it might have spread into the lymph nodes, or if there's any spread into any of the other organs. And really important, therefore, to catch it early. We talk about the grade of breast cancer, and this is really how the cells look like down the microscope, with grade 1 being cells like normal tissue, grade 2 being in the middle, and grade 3 are the ones that we're particularly worried about, as these cells are growing quite quickly and we need to catch them early. All patients with breast cancer are managed in a special meeting or multidisciplinary meeting, where there are surgeons like myself, but also oncologists and radiologists that all help provide a suitable treatment plan for patients. Treatment is often surgery in the first instance, and we have a number of oncoplastic techniques where we try and save the breast as much as we can, as well as saving the sort of aesthetic side of things. Often we check for lymph nodes that are typically under the arm to see if there's any involvement or whether or not there's any spread of cancer cells. This is just a slide to show that most of the time we are performing simple operations where we can remove the small areas of cancer, but sometimes the cancer can be quite extensive and patients need to have a bigger operation, which is called a mastectomy or a removal of the breast. This can be followed up with reconstructive procedures such as an implant, which is a prosthesis that forms in the breast, or we take one's own tissue to create a breast, and this is called an autologous reconstruction. There might be other treatments such as radiotherapy, and this can reduce the risk of cancer coming back. Hormone treatment for cancers that are related to hormones, chemotherapy if the cancer is especially aggressive or based on tumor biology, and now more and more there are targeted treatments to help improve outcomes. Life after treatment, and we'll hear a lot from Kreena about this, but most women lead long, healthy lives after treatment. There are lots of supports available through the NHS, charities and community groups. And I'd like to just dispel a few myths that are commonly asked. So cancer only runs in families. I think that's a myth because most cancers have no family history. Approximately those cancers with a family history are about 15%. Surgery spreads cancer. Again, that's a myth. We aim for surgery to cure cancer or remove the cancerous tissue. As I've just discussed, treatment often does not mean removing the breast, and that's really a last resort for us. We try and maintain the breast as much as we can. And most women survive and lead normal lives, and the key really here is presenting early. So what can you do? Know what your normal is, examine your breast regularly, check yourself monthly, see your GP early, attend mammograms, and talk to others in the community and spread the message. My real take-homes are examine your breast regularly, present if any new symptoms, and please do attend screening. Jai Swaminarayanan, thank you for your time.
Thank you, Meera, for that insightful talk and for explaining all the risk factors to do with breast cancer, the importance of examining yourself, and also explaining briefly the treatment options that are available for breast cancer. So thank you for that. Next, we have a familiar face, Dr. Chandni Depala. She is a consultant breast radiologist and a volunteer with the BAPS healthcare team, who will be telling us a bit about what type of investigations we might come across when we go for screening, or what might happen in clinic if you're referred to clinic for a breast problem. So Chandni, I'll hand it over to you.
Thank you, Arti, for that introduction. Just hope you can see my slides. So I'll be talking briefly about what type of X-rays and scans are involved when investigating breast conditions. So Meera briefly touched on this. So the most common sort of radiological test that we use is a mammogram. It's first line in patients above the age of 40. Also used in breast screening in women over the age of between the age of 50 and 70. It's an X-ray test used to take images of the breast. So it's a very quick test. Mammographers are essentially radiographers specially trained to perform these images. They gently position patients into the mammogram machine, and at least 2 images of the breast are taken. So on the other end, we see images that look like this. So we're able to look at both sides and compare, and we usually look at previous year's mammograms and check if there are any changes as well. Another form of test that you may encounter is an ultrasound. This is not an X-ray test. This is essentially sound waves that are used to produce moving and live images. So the operator, who is the person performing the scan, is able to see the images live as they're doing the study. It's commonly used along with a mammogram, but also used as the first test in those under the age of 40, and also in male patients as well, because we see both males and females in our clinical setting. This is essentially a still image of an ultrasound. So we look at images like this. This is a very common non-cancerous condition, which is a breast cyst. We see this quite often. You may have heard of having a biopsy done in breast clinic. So this is basically undertaken to help diagnose breast conditions, including non-cancerous conditions as well. It is essentially where we use a needle to take samples from inside the breast of the area that is the problem. We usually do this with the use of ultrasound or X-ray to guide where we're taking the tissue from. This is done under local anesthetic and is generally a very well tolerated procedure. It's quick, can usually be done at the same time of the ultrasound or the X-ray tests that are being performed. The results take over a week, but it depends on your specific clinic. This is because the tissue has to go to the laboratory to be analyzed, and then the results come back after that. And in some occasions, a repeat biopsy may be required if additional tests are required in the lab, or there isn't enough tissue. Another test that we sometimes perform is an MRI. This stands for magnetic resonance imaging. It's a very specialized study and is only used in certain scenarios, and not everyone needs this when they come to the breast clinic. It is basically where magnetic waves are used to create images, so there is no radiation involved in this test. As you can see in the picture, the patient is lying on their tummy with their breasts in a specific special mold, and they have to stay in this position for about 30 to 40 minutes, and it's very important that the patient lies still so we get good images. Dye is injected in the vein, and this helps us pick up abnormalities in the breast. And this is some of the pictures that we would get after an MRI, and it's just an example to illustrate that, really. In summary, so each test has its advantages and specific uses. The most important thing is really to discuss all your symptoms with your doctor so that you are referred for the correct tests. And also, it's very important to be specific about which part of the breast is involved so that the imaging test can be quite localized and specific. And biopsies are small routine procedures which we commonly perform and shouldn't be feared. And that's all from me. Back over to Aarti, who will take the seminar further.
Thank you, Chandni. Thank you for explaining all those different imaging techniques and the different investigations that you can have when you go to breast clinic. And obviously some of them are also used when you go to do your breast screening as well. So I'd like to finally introduce our third speaker for today, who is our breast cancer patient advocate, Kreena Dhiman, who works with the Estee Lauder company's breast cancer campaign. She'll be sharing her story and answering some questions about her own lived experience of having breast cancer. So to start off with, Kreena, I'd like you to take us to the start of your journey. And can you tell us about what symptoms you had in the beginning and how did you seek help for those symptoms?
Sure. Thank you for having me, Arti. So, for me, my symptoms came at a very young age, and that was very unusual. So I was 33 years old, quite newly married, and I had no idea what the signs and symptoms of breast cancer were. And this really was despite the fact that my ba had had breast cancer twice, and as a family, we really never talked about the disease or explored sort of what the signs and symptoms were beyond her diagnosis. So I guess I was sort of young, fit, and healthy. I had very few risk factors in that I wasn't overweight, I wasn't a drinker, I wasn't a smoker. I led a relatively healthy life, and could, just was being a regular girl, getting married. I had a good job, and we bought a home, and kind of were on a path that was quite conventional. And then one day I noticed that my left nipple had inverted. And I just said to my husband, oh, I must have worn something that didn't fit particularly well because look, my nipple's inverted. And, we both laughed at it and we ignored it for maybe a week. And then he pushed me to go to the doctor and said, this doesn't look like it's normal. I think you should go to the doctor. And so this was over a weekend, and I remember picking up my laptop and sort of just Googling, what does an inverted nipple mean? And almost every search result pointed towards potentially it being breast cancer. And so it was a really scary time for me. And when I then reflected on my breast and my breast health, I had been feeling pain in my breast and I had been feeling pain in my armpit, but I just never took it seriously. I kept finding an excuse for it. So I kept saying to myself, I've been to the gym, I've lifted too much weight, and that must be what the pain is. But yeah, I found out the hard way that it was breast cancer.
Thank you, Kreena. And I think after as you've described, after receiving such life-changing news as you did after you found the inverted nipple, things must have been quite difficult mentally for you. So how did you manage the emotional and psychological impacts of what you went through?
Yeah, I think sometimes the emotional and psychological is harder to deal with than the physical disease and the physical loss of a breast, because societally I felt very isolated. We don't as a community talk about cancer enough, and if we do, it's kind of a bit hush hush behind closed doors, which just sort of perpetuates the stigma and shame really associated with the disease. So I felt really lonely, and like I said, I'd been married for a year and a half when I was diagnosed, and I'd kind of probably, like many other Indian girls, grown up with marriage being sort of the epitome of success in many conversations. Everyone was like, sort of, when are you going to get married? When you get married? So when I had got married and was planning for a future, having children, etc., for a breast cancer diagnosis to come and take that all away was really, really painful. And I knew also that as we had conversations about my disease, that it was very likely that I'd lose my fertility to treatment. And that was, again, a really difficult thing for me to take, because as Indian girls and Indian women, we're just sort of, I remember I would do vrat, and my parents would say, oh, you're going to get a good husband, and everything was about having a good husband and having children and making them proud. And so when the disease crossed my path and I lost sort of everything that made me marriageable, everything that made me fertile, I kind of felt quite worthless. And so I kind of spiraled from a mental health perspective. I shut myself away. I wouldn't share my story, and it took a lot of time and courage for me to start talking about the disease and the effect that it had had on me. But I did, I think what I always had, and obviously what this group has, is a strong faith. And I do think that for me, faith and that belief that actually everything was going to be as it was meant to be, and so I needed to stop fighting it, is what helped me overcome sort of some of the darkest days, and knowing that I was supported and held, and and it was going to work out just as it was written for me. So I started to sort of let go and surrender to it a bit more. And And it's when I started doing that, I began writing, and I was looking for other sort of Indian girls online, and I couldn't find them. And so I thought, well, maybe I just should share my story and someone might resonate with it, and I might start connecting with other people like me. And so I started blogging and sharing on social media, and, you know, very quickly realized that not enough people were doing it publicly, but there were a lot of people in private who were struggling with the disease and really appreciated being seen by another person. And from then on, I guess my advocacy has just grown.
Thanks for sharing those thoughts, Kreena. I think you've spoken about a few things that quite a few of us being South Asian women can probably resonate with. I think the topics that you've spoken about as you went through your diagnosis. So, and it's obviously very personal. So thank you for sharing those thoughts. And leading on from that, can you tell us about a bit about what your treatment journey was like through this?
Yeah. So as Dr. Joshi was saying, you know, there are different stages and grades to breast cancer. My breast cancer was actually stage 3 and grade 3 and incredibly aggressive. So it was growing very quickly. It had spread outside of the breast, and I had to eventually have all of my lymph nodes removed. And so I was dealing with something that was quite aggressive, which is quite common in young women when they are diagnosed. So unfortunately, I couldn't have a lumpectomy. My entire breast had to be removed, and that was the first bit of treatment that I had. And then later, further down the line, we had the second breast removed because there were potential genetics that were making me susceptible to breast cancer. I did have my breast reconstructed, and again, like we saw earlier, we used a DEP flap, so we used my own tissue to build my breasts. And in terms of sort of conventional therapy, I had chemotherapy, and then I had radiotherapy as well. So 14 rounds of chemotherapy and 25 rounds of radiotherapy. And I'm currently in year 12 of hormone therapy. So my cancer was hormonally sensitive, so it was being fed by the estrogen and progesterone in my body. So at 33, I was put into a medical menopause, and, you know, have been taking sort of medication that stops estrogen in my blood. So if I had any rogue cancer cells, they're not going to feed off the estrogen. So, you know, that in itself has been brutal, being menopausal from 33. I then went on, unfortunately, to suffer heart failure. So some chemotherapies can be cardiotoxic. And for me, unfortunately, you know, chemotherapy took its toll on my heart, and I was diagnosed with severe heart failure in 2016. So for me, treatment for my heart is lifelong. But, you know, I'm grateful to be here and have a heart that still beats. So we kind of roll with that a little bit. And, you know, like I said, because I was menopausal and I had this hormonally sensitive cancer, and coupled with my heart failure, fertility was really difficult for me. And, you know, with motherhood being so important personally and, you know, in community, I had a long path to parenthood, and that involved surrogacy and egg donation and IVF and overseas treatment. But, you know, for me it worked, and I'm sat here today as a mum of 4 children, you know, a little girl and triplet sons. So it was painful and grueling, but, you know, we do have a beautiful happy ever after.
Thank you, Kreena, for sharing that story. I think you gave us a real insight into your journey, and actually it's quite heartwarming to hear how you got through it all. We're going to move on to an aspect of caring for your breast health, which Kreena was going to talk about, which is how to do the self-examination. So we've got a nice video that sums up how to do the self-examination. So if we show that on the screen now, and then hopefully we can speak to Kreena when the video finishes.
તમને ખબર છે બહેનો, 7માંથી 1 સ્ત્રીને જિંદગીમાં છાતી બ્રેસ્ટ કેન્સર થાય છે. આપણે જાણીએ છીએ કે આપણી સ્ત્રીઓ પોતાની છાતી નિયમિત તપાસતી નથી. આપણી ઘણી બહેનો તપાસવાનું કેવી રીતે કરવાનું તે જાણતી નથી. એના માટે કેમ છાતી કેવી રીતે તપાસવાની એનો વિડીયો ગુજરાતી ભાષામાં બનાવ્યો છે. આપણે શરમાયા વગર સગા સંબંધી બહેનપણીઓને આ જાણકારી કરવાની એ ખૂબ જ જરૂરત છે. આપણે દરેક મહિને તે જ દિવસે છાતીની તપાસ કરવાની. નિયમિત આપણે છાતીની તપાસ કરતા કેન્સર નથી શોધતા, પણ એ જાણીએ છીએ કે આપણી છાતીનું શું નોર્મલ છે અને ખબર પડે કે કંઈ ફેરફાર થાય છે તે ધ્યાનથી ડૉક્ટરની સલાહ લેવાની. તપાસવા માટે આરીસા સામે ઊભી રહીને આપણા છાતી કપડા વગર તપાસવી. આપણી આંગળીથી ટચ જુઓ અને લુક તપાસો. છાતીના બધા ભાગ બગલમાંથી કોલરબોન સુધી કરવાનું. છાતીના ઉપલા ભાગથી બગલમાં કોઈ પણ ગાંઠ કે સોજા લાગે છે, છાતીનો રંગ ફેરફાર છે, છાતીની દીટી અંદર તરફ વળી ગઈ, દીટીમાંથી કંઈ લોહી નીકળે છે પ્રવાહી, છાતીમાં આકાર અથવા સાઇઝ ફેરફાર લાગે છે, છાતીનો દુખાવોમાંથી કેન્સરની કહી ના શકાય, પણ છાતી અને બગલમાં કાયમ દુખાવો રહેતો હોય તો આમાં ખાસ ધ્યાન આપીને ડૉક્ટરની સલાહ લેવાની.
I think we do have Kreena back again. Kreena.
Hi, I am back.
Hi, Kreena.
Sorry.
No, that's okay. So, seeing as we've just watched the video, I'd like to ask you. So, this was one of the resources that you created to
Yeah.
try and get awareness out to women in terms of examining their breasts. Can we speak? I just wanted to ask you, are there any other resources that you could point our audience to, anything useful that our audience could use to gain more knowledge on breast health and how to examine their breasts?
Yeah, I mean, I just so this video was created because we saw that there was a lack of resources, particularly in our sort of mother tongue. So for anyone who has friends who are not Gujarati speaking, we also have them in Hindi, Urdu, Punjabi, and then English as well. So I can share links for all of those after today's webinar. And then we also have a separate sort of short video on screening. So it really covers everything that we've talked about today, but why it's important to self-check your breasts at least once a month to get, familiar with what is normal for you, so that when you, or if you ever find anything unusual in your breast, you are empowered when you go to your doctor. So in terms of other resources, there are leaflets that I think we are going to attach to today's webinar information pack. And I think, I think that's about it. The real message here is to know your signs, know your symptoms, which are on some of the slides, and then make sure you check routinely so that you're empowered when it comes to your breast health.
So thank you, Kreena. I think you summed up my last question already, which was, what is the main message for our audience? And I think you said that, which was know your signs, know your symptoms, and make sure you check regularly. So thank you so much, Kreena.
Thank you.
Next, we're going to move on to our rapid fire round, which is a set of questions for our doctors on the call today, where we'll be addressing some common themes and misconceptions. So Meera and Chandni, if I can start asking you the questions. So the first question is for Meera. Is it true that only women get breast cancer?
So that is a myth, and unfortunately men do get breast cancer, but the higher risk factor is being a female gender. So in a clinic I probably see 2 or 3 male patients a year, so it does happen, but it is quite rare. But it is, I encourage all men, if they have anything different in their breasts or anything feels, number one, to check routinely, but if there are any changes, just to get it checked out and to go and see your GP.
Okay. And what are the warning signs that should never be ignored? So this is on top of a lump. Are there any other warning signs that should never be ignored?
One of the biggest warning signs are things like nipple discharge. I think that's really important, or changes to the nipple, just as Kreena was saying. Lumps behind the nipple or behind the areola complex can be quite easy to miss. So it's really important when checking, not only just checking the outer breast, but also the central area. Lumps also in the armpits, sometimes they can be quite common if we've got a cough or cold, a bit like when we get glands up in the throat. But again, if things are persistent, to really get them checked, especially in that armpit area. If anything just doesn't feel quite right, or there are some skin changes, these can all be quite subtle signs that should just get checked out.
Okay. And can you get breast cancer without any symptoms at all? So without any noticeable symptoms?
Yes, and that's where really screening comes in. And it's so important to have that because unfortunately, when we can feel breast lumps, they can be quite large in size, not always, but picking these symptoms and signs and lumps up early is really key. And that's where the screening program really kicks in, because it can pick up things that are very small or very subtle. And we know that by removing these areas, often surgically, it can just reduce the chance of it becoming a cancer or the cancer spreading. So really the key in survival and overall health is picking things up very early on.
And can wearing an underwire bra increase your risk of breast cancer?
No, that's a myth. There's no correlation with that. Whatever women are comfortable wearing.
Okay. And is breast pain a sign of cancer?
So most of the time, breast pain is not a sign of cancer. I kind of mentioned it subtly in my talk, but it does come up quite frequently. Going back to your last question on bras, I think it's really important for women to just get a bra check, just to make sure that the type of bra that they're wearing is comfortable for them. I think sometimes women can buy bras at a certain point in their lives, and naturally changes in shape can occur. So it's really important if to get things checked and just get a bra fitting, which could be done at a local on the high street check, as opposed to anything medical, just to make sure that a supportive bra is right for them.
So I think that's good practical advice. And does family history influence breast cancer risk?
It's a good question. Most breast cancers that I see are not don't have a family history. There is a certain proportion that do. So 85% of breast cancers don't have a family history. So that's the majority of patients that I see. There are certain characteristics, because we typically ask about a family history in the clinic consultation, and sometimes women can have genetic tests, but it's often at the point of being diagnosed. If some women get genetic breast cancers very early on, then we often do a genetic test just to see if there's any susceptibility in the genes that's affecting their risk.
Okay. And this one's for you, Chandni. I think we've been through this already, but just a quick recap. What is the age for breast screening?
Breast screening starts at the age of 50 to 70, but beyond 70, women are able to self-refer themselves. So between 50 and 70, you'll get called for your routine mammograms every 3 years, but after 70, you're still able to get a mammogram. You just have to contact the screening units yourself. So those are the ages.
Thanks, Chandni. And if I didn't want a mammogram, is an ultrasound enough as part of the screening?
Ultrasound and mammograms are two different tests which used for slightly different things, picking up slightly different things. So ultrasound is by no means an alternative to a mammogram. So depending on your symptoms and what you present with and what the clinicians feel, a test will be recommended to you, and sometimes even both. But I would certainly say it's not an alternative to having a mammogram. And a mammogram is a perfectly safe and generally well tolerated test that hopefully people wouldn't mind having done.
And are there any alternatives to mammograms?
Do you mean for screening?
Yeah.
So mammograms are what we use for screening in the UK. There are lots of studies in other countries and also in the UK looking at other tests for screening. But at the moment, the only validated test for screening is mammograms.
Okay, and the last one is for Kreena. I'm going to ask you, Kreena. So at what age should women start self-examining their breasts? So is there an age or?
Yeah, I mean, this is an interesting one because obviously I never grew up with checking my breasts or any form of breast awareness. I have a 7-year-old daughter, and actually she knows now where her chest is, where her breasts will be, and how she should check her breasts. And obviously my children have, they've seen the scarring on my own body and they've asked where that's come from. And I say to them, in very lay terms, I tell them how mummy had, something nasty in her breast and it made her very poorly. So it's really important that as she grows up, she's aware of her chest and her breast, and she has a really good routine. So we have self-check stickers in our bathroom, and she'll read them. Maybe whether she understands them or not is another thing, but she'll be like, okay, a lump is this and puckering is this. And so she's already from a very young age learning this. And that's what the point of my work is that if we can raise a generation who are open to having these conversations, we take the stigma away from the disease and we normalize, breast health, they will go and get help just as much as they'd get help for, a flu a flu or if they need your routine testing, they will just find this, breast health is part of their day-to-day lives, and that's ultimately what I want to do. And I tell her, show me how you would check your breast, and she'll do it, and we'll do it, once a week at least. So the routine is there for when she's older and she needs that skill set. And I think that anyone who's got, young children, grandchildren on this call, like, try and have those conversations. Don't make the stigma, don't perpetuate the stigma. You can play a real role in normalizing this conversation and potentially saving the lives of your loved ones.
So yeah, so I think that's a really important message, Kreena, that you can start as early as you can, just to make children aware, breast aware about what to look out for. So now I think we're going to take some questions from the chat, because I think everybody's been posting lots of questions. So the first question is for Meera. How do lifestyle factors common in South Asian culture influence breast cancer risk?
Thank you. Yes, in terms of lifestyle factors, I guess a lot of them are messages that we know about already. So the importance of good nutrition, exercise, healthy eating, reducing. There's a lot of links to ultra-processed foods, so trying to reduce or minimize these in our diets as much as we can. There is some evidence to do with certain types of hormone replacement therapy, which I think was one of the other questions in the chat that I was just looking at. So there are conditions that it can predispose, or be certainly external hormones can be a risk factor. So there are plenty of things that not only reduce your chance of getting breast cancer, but also improve your cardiovascular health, for example. So lots of things are linked in together. I think supporting each other in our communities, just as Kreena was eloquently saying, there's a lot of stigma associated, and being able to talk about it, encouraging relatives, people that we know about, or it certainly is something that I tell my family quite frequently. So I think just raising that message and awareness is really important, which is why we're so grateful to have this platform today, to be able to spread that.
Aarti, I will just chime in there, because we know from data as well that type 2 diabetes makes you more susceptible to breast cancer. And, in our community, type 2 diabetes is quite prevalent. And so, that's also something to be mindful of, that as a community, we're more susceptible to diabetes, which in turn makes us more susceptible to breast cancer.
So the next, the next question is again for Meera. you've briefly touched on hormone replacement therapy, but does taking the contraceptive pill, Mirena coil, increase the risk of breast cancer?
Yeah, I think that's a good question. We recommend women that are at high risk, certainly those with a family history, to try and reduce their intake of external hormones or look at other ways of, certainly with contraception, but there are associations with it, particularly with HRT, for example. So women that have breast cancer newly diagnosed, one of the first questions, if they are on HRT, one of the first things that I do is try and reduce their HRT initially and then stop it altogether, because certain breast cancers can be fueled by hormones.
Thank you, Meera. The next question I have is actually for Chandni. So, Chandni, can a biopsy cause cancer to spread or get worse? And does a biopsy leave any scars?
So a biopsy is a very safe procedure. It doesn't cause the cancer to spread along the sort of the course of the biopsy needle. It's not something that that happens or we worry about in clinical practice. It doesn't make the cancer get worse. It's purely just a small sterile needle that goes inside the area of the breast, and we take a small tissue, so we don't worry about any of those things. In terms of scars, a biopsy, the actual cut that we do for a biopsy is a couple of millimeters, and it heals within a couple of days and leaves no scars. So it shouldn't be anything that anyone should worry about.
Okay, thank you, Chandni. Next question is for Meera. Is breast cancer always cured?
I'd like to say the answer to that is yes, but unfortunately not, and we cannot cure all patients. One of the curative ways, or we try and offer a cure, is through surgery, so removing the breast cancer area. But no, it's not always cured. I think this links into the earlier messages in the talk that if we can catch it early, certainly before it spreads, the first place of spread is typically the lymph nodes. But before it spreads, before it goes to the rest of the body, I think it's really important to do that. So catching it early, but we do try and cure as many women as we can, and those women that we do catch early on through screening or presenting early have good survival.
Thank you. Meera, another question for yourself. What do men need to look out for with regards to breast cancer?
So again, it can be very subtle changes in their breast. Sometimes it can be pain, anything that's typically asymmetrical. So they have it in one breast and they it's not necessarily the same in other. Swelling, discomfort, discharge. Men also may have a family history, so really important to get it checked. I think for men as well, they may have their own stigma, or not wanting to attend a breast clinic. It can be maybe quite challenging attending in a breast clinic, and where I can, if I know I've got a male patient coming to see me, I'll try and see them very early on in the clinic, so that hopefully not having to wait too long. But lots of, I think anything that they're unsure about, to get it checked. And unfortunately, we do see breast cancer in men, like I say, in approximately 80 to 100 patients a week that I see. I probably see maybe 3 male breast cancers a year, so it isn't common, but it can occur. So anything that's just doesn't feel quite right, it's really important to get it checked out initially through the GP, and then to the hospital to have it checked. And similarly, men will have similar tests of, an ultrasound, as you've mentioned, Chandni, a mammogram and a biopsy. And the treatments, again, are very similar in terms of surgery, radiotherapy, sometimes chemotherapy, hormone tablets. So very similar treatment plans to what men have. We treat men quite aggressively because it's quite rare for men to get breast cancer. So often men do have all forms of treatment that are available.
Thank you, Meera. I think the important thing to note there is men should also present to their GP if they have any of the symptoms, because
Exactly.
their GP can refer them onwards. The next question I have is for Kreena. Kreena, can you tell us a little bit about what life is like after you've had breast cancer?
I think it's really important when you've been through breast cancer to find a support network, because myself and anyone in my community will say the hardest part is often rebuilding your life after breast cancer. When you're in active treatment, you're quite protected, you're in a bubble and you have clinicians looking after you. When you come out of that, it can be a very difficult time. So find your community and find your tribe. And find your resilience, because you will have loads of it if you've been through a breast cancer diagnosis and come out the other side. And for me, I've lent into that and, curated a really beautiful life with, 4 quite miraculous children and, a marriage that survived some of the toughest challenges. So my advice is always, you're not going to be able to change the disease if it comes to you, and you're not going to be able to get rid of it if you ignore it. So don't ignore your signs and your symptoms, get treated early. And actually to touch on the conversation we had earlier about, is every breast cancer cured? And, it's not. And, I have lots of very good friends who live with an incurable cancer, but even in that scenario, there is a quality of life that can be had. And there is a real impact that can be had beyond the disease. And so I think that even if you are diagnosed with a late stage breast cancer, or you have an incurable breast cancer that's, or you've had a recurrence of breast cancer, it doesn't mean life has ended. There is still hope, and there is still so much love and life to be lived beyond the disease, and don't be afraid of it.
Thank you, Kreena. And we've got one from the chat, which I'd just like to ask Meera. So does HRT for menopause increase the risk of breast cancer? And there are,
I think this is really, there are so many different variations on HRT, and I think it's really important just to get that checked with your GP, the type and how you get it. So we try and limit external hormones as much as we can, but trying to limit that, I think, is important.
Okay, thank you. And one last one for Chandni. If I have just had a screening mammogram and then lump develops, do I still need to go and get it checked?
So the answer is yes, you still need to go and get your lump checked. Although mammogram is a very good screening tool, and that's why it's validated. Any lump that you feel needs to be clinically examined. A doctor needs to feel and see the lump itself and decide whether any other tests are required as well. So yes, even if you've just had a mammogram, a few days ago, and you feel a new lump, it's very important to still get it checked out.
Thank you, Chandni. So I think we're gonna end there. So throughout this webinar, we've explored what you can do to take charge of your breast health and how you can support other people to do that as well. On the screen now, we're going to share some useful links to some short videos and web links from our speakers today that have been mentioned through the talk. Please also, can you fill out the feedback form that we've posted in the chat? And I would just like to say thank you so much to all of our panel speakers today for giving us all the valuable information and guidance. Jai Swaminarayan, and have a good evening, everybody.